Stop rubbing expensive retinol creams onto your arms and wondering why nothing changes. If you've spent years buying jar after jar from the pharmacy counter, hoping the next one would finally be the one that worked, I need you to hear this before you buy another, because the skin on your arms behaves completely differently from the skin on your face, and almost nobody selling you those creams ever explains why. I'm Dr. Margaret Wilson, a physician, and over the years I've worked closely with patients on the kind of skin changes that creep up quietly after 60. The thinning on the forearms, the crepe-like texture that seems to appear overnight even though it's been building for decades, the way skin that used to snap back when you pinched it now just sort of stays there. Dermatology researchers have long understood that the skin on your arms is structurally thinner and has fewer oil-producing glands than the skin on your face, which is part of why so many face creams simply don't perform the same way when used on your arms. What does work, according to research on skin barrier repair, is a combination approach, pairing occlusive ingredients, meaning ingredients that physically seal moisture into the skin, with specific actives that support your skin's own collagen-building machinery from the outside in. Used consistently over roughly 8 weeks, this kind of layered topical approach has been associated in clinical skin studies with measurable improvements in skin elasticity and hydration, particularly in adults over 60 whose skin barrier has weakened with age. Before we go any further, I want to ask you something, because I read every comment on these videos, every single one. Tell me in the comments right now, how old are you, and what's the one thing about your arms specifically that you avoid wearing because of how the skin looks? Is it short sleeves, sleeveless dresses, lifting your arm to wave, and feeling that skin move in a way it never used to? I want to know who's actually watching this, because everything in today's video is built for people exactly like you. Before we dive into the mixture itself, let me tease something, because I don't want you to miss it. Item 2 on this list today involves an ingredient sitting in almost every kitchen in America, completely overlooked for skin, yet some research suggests it may help support your skin's natural moisture barrier in a way that surprised even me when I first came across the studies. So stick with me, because we're counting down from 5, building toward the full mixture and the single most important step in how you apply it. Let's start at number 5. Number 5, the carrier oil holding the entire mixture together. And the dramatic truth about why so many people get this part wrong. Here's something most people never consider. The oil you choose as your base isn't just a filler ingredient. It's the delivery vehicle for everything else in your mixture. And choosing the wrong one can mean the difference between actives that actually reach your skin and actives that simply sit on the surface, evaporating before they do anything useful. Research on topical skincare absorption has consistently pointed to certain plant oils, particularly sweet almond oil and jojoba oil, as having a molecular structure similar to the skin's own natural oils, called sebum, which allows them to blend into the skin's surface rather than sitting on top of it like a layer of plastic wrap. Think of your skin's surface like a brick wall, where the skin cells are the bricks, and a substance called the lipid matrix, made up of fats, is the mortar holding everything together. As we age, that mortar breaks down and thins, and a poorly chosen oil just slides right over the cracks without actually getting into them. A well-matched oil, on the other hand, behaves more like a liquid mortar that seeps into those cracks and helps rebuild the wall from within. This matters significantly more after 60, because the skin's natural oil production declines substantially with age, and the lipid matrix we just described becomes thinner and less effective at holding moisture in, which is part of why skin that used to look dewy in your 40s can look dull and crepey decades later, even with the same amount of moisturizer applied. For preparation, you want a cold-pressed, unrefined version of either sweet almond oil or jojoba oil, since the cold pressing process preserves more of the beneficial fatty acids and vitamin E naturally present in the oil. A few tablespoons will form the base of your mixture, which we'll build on as we go through this list. Apply your finished mixture once we've built it, to slightly damp skin rather than completely dry skin, ideally right after a shower, since damp skin allows oils to spread more evenly and absorb more readily than fully dry skin does. Your synergy tip here: warm the oil slightly between your palms before applying, just from the natural heat of rubbing your hands together for a few seconds, because gently warmed oil flows into the skin surface more easily than cold oil straight from the bottle. I think of my patient Joan, 73, from a small town outside Des Moines, Iowa, who'd tried what she estimated was a dozen different drugstore lotions over the years, with no real change to show for it. When we looked closely, most of her past lotions contained heavier mineral oils that simply sat on the surface of her skin, rather than blending in. We switched her base entirely to a properly chosen jojoba oil, Within a few weeks, before we'd even added the rest of the mixture, Joan told me her arms already felt less like paper and more like skin again. Her words exactly. Number 4. The moisture-trapping ingredient almost nobody pairs correctly, and why getting this step wrong wastes everything you've done so far. Here's the dramatic truth about hydration that most skincare marketing gets backward. Applying moisture to your skin and trapping moisture in your skin are two completely different jobs, and most products only do the first one. This is where an ingredient called glycerin becomes essential, a naturally derived substance known scientifically as a humectant, meaning it actively pulls water molecules toward itself and holds onto them. Think of glycerin like a sponge sitting directly on your skin's surface, constantly drawing in available moisture from both the air around you and the layers of your skin underneath, then holding that water in place rather than letting it evaporate away within minutes the way plain water on skin normally would. Research on skin hydration in older adults has shown that humectant ingredients like glycerin can meaningfully improve skin's water content when used consistently, which matters enormously after 60, because the skin's ability to retain its own water content declines with age as the structures responsible for moisture retention, including those ceramides we touched on briefly involving fat molecules in the skin, become less abundant over the decades. Without something actively holding water in place, even the most expensive moisturizer largely evaporates within an hour, leaving you to reapply again and again throughout the day for diminishing results. For preparation, you'll add roughly 1 tablespoon of pure vegetable glycerin, easily found at most pharmacies, to the oil base we built in the last step, stirring thoroughly since glycerin and oil don't fully blend on their own and benefit from a good minute of mixing or a quick shake in a small sealed jar. Apply this combined mixture once in the morning and once before bed for the most consistent results. Your synergy tip: mist your skin lightly with plain water immediately before applying the oil and glycerin mixture, since glycerin needs water nearby to actually pull inward, and applying it to bone-dry skin gives it far less to work with. This is a good place to pause because I want to ask something of you, and it costs nothing. If you've stayed with me this far, please hit subscribe and tap the like button. I make these videos because people your age deserve clear, honest information instead of marketing dressed up as medicine, and the only way YouTube shows videos like this to more people exactly like you is if you tell it to, with a simple like and subscribe. It takes 3 seconds and it genuinely helps. Now the next 3 ingredients are the heart of this entire mixture, so let's keep going. Number 3. The vitamin-rich oil almost nobody adds correctly, and the reason it deserves a place on this list. Here's something that surprises most of my patients. Vitamin E, widely available and inexpensive, is one of the more well-studied topical antioxidants for skin, meaning it helps neutralize unstable molecules called free radicals before they can damage skin cells and break down existing collagen, the structural protein responsible for skin's firmness. Researchers studying skin aging have noted that topical antioxidants like vitamin E may help protect skin from some of the cumulative oxidative damage that builds up over decades of sun exposure, pollution, and simply the normal aging process. Think of free radicals like tiny sparks constantly landing on dry grass. Most of the time, nothing happens. But over years and decades, enough sparks land in the same places that the damage accumulates into something visible. Vitamin E acts like a light, steady rain over that grass, not putting out every spark instantly, but reducing how much damage each one is able to do. This becomes more relevant after 60 because your skin's own natural antioxidant defenses, the systems that would otherwise handle this job internally, become measurably less efficient with age, leaving topical antioxidants to pick up more of that protective workload than they would have needed to in younger skin. For preparation, you'll want pure vitamin E oil, sold either in a small bottle or as individual capsules you can puncture with a clean pin and squeeze directly into your mixture, adding roughly half a teaspoon to the oil and glycerin base you've already built. Stir thoroughly, then store the completed mixture in a small dark glass jar, since vitamin E and the other oils in your blend degrade more quickly when exposed to direct light. Your synergy tip: store this jar somewhere cool and dim, like a bathroom cabinet rather than a sunny windowsill, since heat and light both shorten how long the antioxidant properties remain active and effective. I want to tell you about Walter, 76, from a quiet neighborhood outside Tulsa, Oklahoma, who developed what he called alligator skin on his forearms after decades of outdoor work in his younger years. We built him this exact layered mixture, oil base, glycerin and vitamin E together. Walter was skeptical. He told me so directly, having tried plenty before. Around the 6-week mark, his wife mentioned, almost in passing, that the skin on his arms didn't catch on his shirt sleeves the way it used to when he got dressed in the morning. Small, practical changes like that are often the first sign that something deeper is actually working. Number 2. The kitchen ingredient I promised you earlier, the one almost nobody associates with skin at all. Here it is, plain, unflavored gelatin, the same powder used in cooking and baking, derived from collagen itself through a process that breaks it down into smaller protein fragments called peptides. Now I want to be very clear and honest with you here, because there's a meaningful difference between eating gelatin, which some research suggests may support the body's own collagen production from within, and applying it topically, which works through an entirely different and more modest mechanism, primarily by forming a thin temporary film on the skin surface that can temporarily improve smoothness and the appearance of firmness. Some smaller skincare studies have explored gelatin-based topical masks for their short-term tightening sensation, related to how the gelatin dries and lightly contracts on the skin surface, similar to how a thin layer of dried glue pulls slightly as it sets. Think of it like a very gentle temporary support structure sitting on top of your skin, somewhat like a light compression sleeve worn over a joint, not changing what's happening underneath, but providing supportive structure to what's already there while you continue working on the deeper changes with the rest of this routine. This matters as an addition for aging skin specifically because thinner, less elastic skin often benefits from this kind of light surface support between the deeper repair work happening from your moisturizing ingredients and the body's own slower collagen remodeling process, which research suggests can take many weeks to show visible results. For preparation, dissolve 1 teaspoon of plain gelatin powder into 2 tablespoons of warm water, stirring until completely smooth, and apply this as a thin separate layer over your arms after your oil and glycerin mixture has mostly absorbed, allowing it to dry for 10 to 15 minutes before gently rinsing off with cool water. This step works best 2 to 3 times a week rather than daily, since daily use can be more drying than beneficial for delicate aging skin. Your synergy tip: apply your oil and glycerin mixture again immediately after rinsing off the gelatin layer, sealing in whatever moisture remains and preventing the brief drying effect of the gelatin step from undoing the hydration work you did earlier. I think of Patricia, 68, from a rural community outside Asheville, North Carolina, who came across this gelatin technique almost by accident after asking me what else she could try beyond her regular routine. She added it twice a week alongside the rest of her mixture. At her next visit 2 months later, Patricia rolled up her sleeve without my asking, and told me to look closely, pointing out that the loose, crepey texture on the underside of her arm had visibly softened. I want to be honest with you, the way I always try to be. This particular step works best as a supporting layer, not a standalone miracle, and the real transformation comes from the full combination working together over time. And now, number 1. The single most important step in this entire routine. The one that determines whether everything else we've discussed actually works or simply sits unused in a jar in your bathroom. Consistent, gentle massage during application, and a process happening underneath your skin called fibroblast stimulation that almost nobody explains to patients in plain language. Here's what that means. Fibroblasts are the specialized cells living within your skin's deeper layer, called the dermis, and they're directly responsible for producing new collagen and elastin, the 2 structural proteins responsible for skin's firmness and its ability to spring back into place after being stretched or pinched. Researchers studying skin aging have found that fibroblast activity declines substantially over the decades, with some studies suggesting a meaningful drop in fibroblast density and function between midlife and the senior years, which is a major underlying reason aging skin produces less new collagen even when given the right nutritional building blocks. Here's where this connects directly to how you apply your mixture. Physical massage, meaning firm but gentle circular motions with your fingertips while applying your mixture, has been shown in some research to mechanically stimulate fibroblast activity through a process related to gentle mechanical pressure on skin tissue, essentially nudging these collagen-producing cells into greater activity simply through consistent, repeated touch. Think of fibroblasts like workers in a factory who've grown a little complacent over the years, doing the bare minimum to get by. Mechanical massage acts like a manager walking the factory floor regularly, not yelling, not forcing anything, just present and engaged often enough that the workers naturally pick up their pace simply because attention is being paid to that part of the building again. This matters enormously for aging skin specifically because the natural mechanical stimulation skin receives from daily activity, tight clothing, friction during regular movement, tends to decrease as people become less physically active with age. Meaning skin on the arms in particular often receives far less natural mechanical stimulation in your 70s than it did when you were younger and more constantly active. There's also a circulation angle worth explaining simply. Massage encourages blood flow to the area being massaged, and better local circulation means more oxygen and nutrients delivered directly to those fibroblasts working in the dermis. Similar to how a delivery truck can only drop off packages as quickly as the roads leading to that neighborhood allow. Improving blood flow is like widening those roads so deliveries arrive faster and more often. For preparation, apply your completed mixture using firm, slow, circular motions with your fingertips or the flat of your palm, spending a genuine 3 to 5 minutes per arm rather than a quick, careless rub that takes 30 seconds. Work from your wrist upward toward your shoulder in long, sweeping strokes, which also gently supports lymphatic drainage, the system responsible for clearing waste fluid from your tissues, before finishing with smaller circular motions over any areas of particular concern, like the back of the upper arm. Do this every morning and every evening, for a minimum of 8 weeks before expecting to see the kind of meaningful visible change that comes from genuine collagen remodeling, rather than temporary surface softening. And here's the most important synergy tip in this entire video. Pair your massage routine with a few minutes of gentle stretching or light resistance movement for your arms sometime during your day. Even simple things like raising your arms overhead a dozen times or doing a few wall push-ups, because physical movement itself has been associated in research with improved skin blood flow and connective tissue health. Working alongside the massage rather than asking the massage to do all of that work alone. I want to tell you about Eleanor, 79, from a small community outside Spokane, Washington, who'd grown so self-conscious about her arms that she'd worn long sleeves through 3 consecutive summers, even in uncomfortable heat. We built her this full routine: base oil, glycerin, vitamin E, the gelatin step twice weekly, and the massage technique every single morning and night. She was honest with me from the start that she didn't expect much, having felt let down by products before. Around week 7, Eleanor came in for an unrelated visit wearing a short-sleeved blouse, the first time I'd seen her arms uncovered in nearly 2 years. She told me, a little emotionally, that her daughter had cried a little when she saw it, not because anything dramatic had happened, but because her mother finally seemed comfortable in her own skin again, in the most literal sense of that phrase. All the scientific references for everything discussed in today's video are linked in the description below, so if you'd like to read the research yourself, or bring it to your own dermatologist or physician, everything is there waiting for you. And I do want to add one honest note here, the kind of thing I'd tell you if you were sitting across from me in my office. Everyone's skin responds a little differently, and if you ever notice redness, itching, or irritation from any new ingredient, including the ones discussed today, stop using it and check with your own doctor, since what works beautifully for one person can occasionally irritate another, and your safety always comes before any routine. I want to leave you with something before you go. Getting older was never supposed to mean hiding your own arms under long sleeves in the middle of summer, avoiding mirrors, or feeling disconnected from the body that's carried you through an entire lifetime of memories. Quality of life in these years isn't only about how capable you feel. It's also about feeling at home in your own skin, comfortable enough to wear what you want, to reach for a hug without thinking twice, to catch your own reflection without flinching. None of what we discussed today happens overnight, and I would never promise you that it could. But a consistent routine, repeated faithfully morning and night for roughly 8 weeks, has a way of producing changes that genuinely surprise people, including, often, the patients themselves. It is never too late to start treating your skin like it still deserves attention and care. If today's video gave you something worth holding on to, please subscribe so you don't miss what's coming next, and tap that like button on your way out. It genuinely helps more people exactly like you find these videos. And before you go, tell me in the comments, are you going to try this mixture starting tonight? And which step surprised you the most? I'll be reading every single answer.